Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear an oncology specialist talking to a patient called Mrs. Wilson. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mrs. Wilson. I understand you've recently been diagnosed with cancer. Thank you for meeting with me today to discuss your condition and explore the best treatment options.
Thank you, Doctor. Yes, Well, I was a bit shocked at first, to be honest. I didn't expect the diagnosis to be so serious.
I understand, and that's a very natural reaction. Could you tell me a bit about how you were first alerted to the symptoms?
Sure. It started out subtly, I guess. I had been experiencing fatigue for quite a few months, but I thought it was just part of aging, or maybe stress from work. But then I started having a dull, persistent pain in my abdomen. That made me go to my GP.
Yes, fatigue and persistent pain can often be indicators. Did you notice any other symptoms?
Yes, there were a few other things. I began losing weight without really trying, and I also noticed my appetite wasn't quite the same. Sometimes I'd feel nauseous for no reason, but I thought it might be just stress or maybe some digestive issues.
Those symptoms are quite common with certain types of cancer. I appreciate you being so open. It sounds like you've been dealing with a lot on your own.
Yes, I have. It's just been difficult not knowing what's going on, and now that I do know, it's just scary.
I completely understand. Anxiety and fear are common responses. Many patients feel a loss of control when they receive a diagnosis like this. It's important to acknowledge these feelings as part of the process. Were there any particular concerns you'd like to address today?
Yes, a few. I'm worried about how the treatment might affect my daily life. I still work part-time and am concerned about how I'll manage with any side effects.
Of course. Many treatments, like chemotherapy or radiation, do have potential side effects, such as fatigue, nausea, and possibly hair loss. But we'll work together to manage them, and I can suggest strategies to minimize the impact on your day-to-day routine. For example, there are medications to control nausea, and we can adjust your treatment schedule around your work hours.
That's reassuring to know. I was also wondering about the prognosis. I understand every case is different, but I just want to know what to expect.
That's a very reasonable question. While prognosis depends on the type and stage of cancer, many patients respond well to treatment and can lead fulfilling lives. In your case, we're still gathering information from recent tests, and that will help us develop a tailored treatment plan. Have you been able to discuss this with your family?
I've talked to my daughter. She was very supportive, but I haven't told everyone yet. I guess I'm worried about burdening them.
It's common to feel that way, but remember, having a support network can make a significant difference. If you're open to it, involving loved ones can be a source of strength. We can also connect you with counseling resources if you feel it would help.
I think I might take you up on that. I don't feel exactly depressed, but I'm overwhelmed.
That's very understandable. Adjusting to a diagnosis like this is challenging, and many people benefit from speaking with someone who can help them manage their emotions. Mental health support is an essential part of the treatment process. Now, in terms of practical steps, have you been advised on any lifestyle changes that could help?
Well, I read that I should try to eat healthier. I've been trying to add more fruits and vegetables to my diet and cut back on sugar, though it hasn't been easy.
That's an excellent start. A balanced diet can improve energy levels and overall well-being, which is particularly important during treatment. Staying hydrated and incorporating moderate exercise, if you feel up to it, can also help. Do you currently have an exercise routine?
Not really. I used to go on walks, but recently I haven't felt like doing much of anything.
That's quite common. If you're able to, even short, gentle walks can help boost mood and energy. But, of course, listen to your body and don't push yourself too hard. And lastly, have you been prescribed any medications?
Just some for managing the pain, and they've been helpful. I haven't had anything specific to treat the cancer yet.
Understood. Once we have a clearer picture from the additional tests, we'll discuss specific treatments. Options like surgery, chemotherapy, or immunotherapy may be considered depending on what's best suited to your condition. We'll keep you informed every step of the way.
I appreciate that. I feel a bit more in control knowing that there are options.
Extract 2, questions 13 to 24. You hear a general practitioner talking to a patient named John Walker. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mr. Walker. Please have a seat.
Thank you, Doctor.
I understand you've been dealing with some persistent diarrhea. Could you walk me through how this started and what you've been experiencing?
Sure. It began about 3 months ago. At first, it was just occasional loose stools, maybe once or twice a week. I didn't think much of it, but then it started happening daily, sometimes multiple times a day, and now it's really interfering with my life.
I'm sorry to hear that. Has there been any pattern to it, like specific times of the day or after certain meals?
It's mostly in the mornings, shortly after breakfast. I've also noticed it gets worse if I eat spicy food or drink coffee, which I've tried to cut down on.
That's helpful to know. Have you noticed any other symptoms, such as abdominal pain, nausea, fever, or weight loss?
Well, I do get some cramping right before I need to go to the bathroom, but no fever. I have lost about 5 kilograms since this started, though.
And how frequent are the episodes now?
On bad days, it can be 5 or 6 times. On better days, maybe 2 or 3.
All right. Have you noticed anything unusual in the stools, such as blood, mucus, or a very foul smell?
No blood, thankfully. But they're often very watery and sometimes seem greasy or oily.
Greasy stools, okay. That can sometimes suggest issues with how your body is digesting or absorbing food. Have you tried any over-the-counter remedies or changes to your diet?
I've tried Imodium, which slows things down for a bit but doesn't stop it entirely. I also tried cutting out dairy, thinking it might be lactose intolerance, but that didn't make much of a difference.
Understood. Have you had any recent travel, particularly to areas with less reliable sanitation?
Yes, I went to Thailand about 6 months ago. I didn't feel sick while I was there, but this started not long after I got back.
That's an important detail. Sometimes travel can expose us to infections that take time to show symptoms. Have you had any recent illnesses or been on antibiotics?
No recent illnesses, but I was on antibiotics for a sinus infection about a month before the trip.
That's good to know. Antibiotics can sometimes disrupt the balance of bacteria in your gut. Based on what you've described, we'll need to investigate this further. I'd like to ask a few more questions to narrow things down.
Of course.
Do you have any personal or family history of gastrointestinal conditions like irritable bowel syndrome, IBS, Crohn's disease or celiac disease?
No, none that I know of.
And how's your overall health otherwise? Any chronic conditions or medications you're taking?
I'm generally healthy and only take a multivitamin.
That's good to hear. For now, I'd like to do a few things. First, we'll run some blood tests to check for inflammation, infections, and possible vitamin deficiencies. I'd also like to order a stool sample test to look for infections, parasites, or other abnormalities.
All right.
Depending on the results, we may also consider doing a colonoscopy or other imaging tests. In the meantime, I'd suggest keeping a food diary to track what you eat and any symptoms that follow. It might help us identify triggers.
That makes sense. Is there anything else I should do or avoid?
Avoid caffeine, alcohol, and very fatty or spicy foods for now. Also, stay hydrated, especially if the diarrhea is severe. You might want to try an oral rehydration solution to replace lost electrolytes.
Okay. And do you think it's something serious?
It's too early to say, but many cases of chronic diarrhea are manageable once we identify the cause. It could be something like post-infectious IBS or a food sensitivity, but we'll rule out more serious conditions as well.
I appreciate that.
Of course. Let's start with the tests and reconvene once we have more information. Feel free to reach out if things worsen in the meantime.
Will do. Thanks, Doctor.
You're welcome. Take care, Mr. Walker.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nurse talking about the space admission process. Now read the question.
Over the next 48 hours, I will work with you to complete the hospice admission process. This includes several meetings to explain the steps and ensure clarity. During this time, I will conduct assessments, collect necessary medical history, and help complete the required paperwork. The first meeting will focus on reviewing the patient's current condition and eligibility criteria for hospice care. The second meeting will address the completion of legal and medical forms, including advance directives and insurance paperwork. The third meeting will introduce the interdisciplinary team, comprised of the hospice physician, nursing staff, social worker, and chaplain, who will provide care and support. Finally, the fourth meeting will outline the scope of care, including coordination of medication, equipment delivery, and scheduling the first home visit. At each stage, you will have the opportunity to ask questions and make informed decisions about the process.
Now look at question 26. You hear a conversation between a GP and a neurologist. Now read the question.
Patient with chronic tension headaches and persistent neck pain.
That's correct. Alongside the chronic headaches, the patient has also reported numbness and tingling radiating down the left arm. These symptoms seem to worsen after long periods of sitting or working on his computer. Additionally, I've observed a noticeable reduction in his neck mobility during my physical examination. While it's all outlined in the referral notes, I wanted to reach out because I'm quite concerned about the underlying cause of these symptoms.
I see. I've reviewed the imaging reports attached. I will assess the patient thoroughly during his appointment and call you with my findings afterward.
Now look at question 27. You hear a medical professional explaining implementation of new sanitation standards. Now read the question.
As you may already know, we're implementing new sanitation standards in patient areas to further enhance cleanliness and safety. You might have some reservations about how this could affect your daily workload, which is completely understandable. While maintaining high hygiene standards is crucial, we don't want to put additional pressure on our nursing team. That's why external cleaning teams will be primarily responsible for these new procedures. I've heard some of you worry that managing these standards might still add to your workload through additional checks or supervision. Let me reassure you that our managers will oversee the process closely to ensure these tasks are well managed, leaving you to focus on patient care without extra duties.
Now look at question 28. You hear a nutritionist talking to a patient. Now read the question.
What brings you in today?
I've been feeling down for a while now, and sometimes anxious too. I've heard that what we eat can affect our mood. Is there really a connection between food and mental health?
Yes, that's a great question. And you're not alone in wondering. There is a strong link between nutrition and mental well-being. You see, our brain relies on nutrients to function optimally, just like any other part of our body. For example, omega-3 fatty acids found in fish can support brain health, and deficiencies in certain vitamins like B vitamins or magnesium have been associated with mood disorders and increased anxiety.
That's really interesting. So, changing what I eat could help improve my mental health.
Absolutely. A balanced diet rich in fruits, vegetables, lean proteins, and healthy fats can make a significant difference. It helps regulate mood and may even play a role in preventing depression or reducing symptoms.
Now look at question 29. You hear a discussion between a trainee doctor and a senior GP about complementary and alternative medicine, CAM. Now read the question. Dr. Patel, you've been researching alternative medicine for a while now, haven't you?
Yes, that's right. I've been exploring how practices like acupuncture, herbal medicine, and mindfulness can complement traditional treatments. There's growing interest in these areas, but integration into conventional care is still a challenge.
I've heard a lot of patients inquire about CAM recently. Many of them seem dissatisfied with standard treatments or worried about potential side effects. But then, there's the issue of evidence, whether these methods are truly effective and safe enough to incorporate into practice.
Absolutely. It's a complex issue because while some CAM practices have strong anecdotal support or cultural significance, the lack of large-scale clinical trials often holds them back.
And that's understandable. Patients need to trust that what they are using is effective and won't cause harm. However, I think a bigger part of the problem is the healthcare system itself. It often doesn't allocate resources to research or train professionals to integrate CAM effectively.
That's a good point. It's hard for GPS to recommend something they aren't trained in or fully understand.
Precisely. I believe the lack of institutional support for proper CAM integration is one of the key reasons we are seeing a gap here. Now look at question 30. You hear a morning briefing with a doctor. Now read the question.
Let's get started with today's briefing. Claire, can you begin?
Of course. First up, we have a 72-year-old man who is 3 days post-op following a total hip replacement. He has a history of hypertension and type 2 diabetes. He is now presenting with swelling and pain in his left calf, which began yesterday. Exam findings include tenderness along the posterior calf, mild erythema, and a positive Hohmann's sign.
Thank you. So, what are the next steps?
Based on the clinical presentation and physical exam findings, compression ultrasonography and initiation of anticoagulation therapy are the next steps.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear Dr. Michelle Carter discussing about physician-assisted dying. You now have 90 seconds to read questions.
My name's Dr. Michelle Carter, and I'm here today to discuss a deeply divisive yet critical topic in modern healthcare: physician-assisted dying, often referred to as PAD. It's an issue that challenges ethical principles, individual autonomy, and the core of compassionate care. While some argue PAD empowers terminally ill patients to make autonomous decisions about their end-of-life care, others worry it opens a Pandora's box of moral, legal, and societal concerns. The debate over PAD isn't new, but it has gained momentum as legislation permitting the practice becomes increasingly common in parts of the world. Countries like the Netherlands, Canada, and Belgium, as well as several U.S. states, have legalized PAD under strict conditions. Proponents view PAD as a means to alleviate unbearable suffering, respecting a patient's wish to die with dignity. They emphasize that this practice is not about abandoning patients, but about giving them a choice when all other avenues of relief have been exhausted. However, opponents of PAD argue it goes against the fundamental role of physicians as healers. They raise concerns about a potential slippery slope where the practice could expand beyond terminally ill patients to those with less severe conditions, such as mental health issues or disabilities. There's also the fear that vulnerable populations, including the elderly or economically disadvantaged, could feel pressured to choose PAD due to societal or financial burdens. One of the most pressing ethical dilemmas in PAD revolves around the Hippocratic Oath, which states, "First, do no harm." Advocates argue that prolonging a life of unbearable pain can itself constitute harm, while opponents contend that any action to intentionally end a life violates this core tenet of medicine. The question remains, can alleviating suffering justify a practice that fundamentally opposes the traditional role of a physician? Recent studies shed light on how PAD is perceived among healthcare providers. A 2022 study conducted in Canada surveyed physicians practicing in jurisdictions where PAD is legal. The results revealed a division in opinion. 60% of respondents supported PAD in principle, but expressed discomfort with participating directly. Among those who opposed it, many cited religious or personal values as key factors influencing their stance. Yet despite the ethical controversy,
The majority of participants acknowledge that PAD, when carefully regulated, can bring immense relief to patients experiencing prolonged suffering. Another critical aspect of the debate is the role of palliative care. Opponents of PAD argue that advancements in palliative medicine make it possible to manage pain effectively, eliminating the need for assisted dying. Yet, proponents counter that even the best palliative care cannot address all forms of suffering, such as psychological distress, loss of autonomy, or existential despair. For some patients, PAD represents the ultimate form of control in a situation where they feel they have none. The emotional toll on physicians who participate in PAD cannot be overlooked. Studies show that many experience significant moral distress, even when they believe they are acting in the patient's best interest. This highlights the need for clear protocols and support systems to guide healthcare providers through such challenging situations. As healthcare professionals, our primary obligation is to the patient. For some, this means ensuring the opportunity to live as long as possible, regardless of the suffering involved. For others, it means respecting the right to die with dignity. Striking a balance between these perspectives requires not only robust legislation but also open, empathetic dialogue between patients, families, and caregivers. In conclusion, the debate on physician-assisted dying is unlikely to be resolved anytime soon. It challenges our understanding of ethics, compassion, and the role of medicine in end-of-life care. While the practice remains controversial, one thing is clear. Patients deserve a healthcare system that listens to their voices, respects their autonomy, and prioritizes their well-being above all else.
Extract 2. Questions 37 to 42. You hear a conversation with Dr. Lena Robert on cannabis. Now, read the questions. You now have 90 seconds to read questions.
Today, we're discussing a topic that has gained significant attention in recent years: medical cannabis. Dr. Lena Robert, a physician and researcher specializing in pain management, is here to shed light on its benefits and risks. Dr. Robert, why has medical cannabis become such a hot topic in healthcare, and can you share a bit about its history?
Certainly. Medical cannabis has been in use for centuries. Historically, it was used in ancient cultures for pain relief, inflammation, and even as an appetite stimulant. However, in the 20th century, cannabis became heavily regulated, and much of its medicinal use was overshadowed by legal and societal concerns. Now, research is driving a resurgence in interest. We're beginning to understand that the cannabis plant, particularly its active compounds like THC and CBD, hold significant therapeutic potential. For example, recent studies have shown that it can alleviate chronic pain, reduce nausea in cancer patients undergoing chemotherapy, and manage symptoms in conditions like epilepsy.
Those are compelling benefits. But why is there still so much controversy surrounding its use?
One of the main reasons is the lack of large-scale, long-term clinical studies. While smaller studies have shown promise, the medical community is cautious about adopting it broadly without more robust evidence. There are also concerns about its potential for abuse and dependency, as well as side effects like cognitive impairment or anxiety. Another factor is the inconsistency in how cannabis is regulated, both globally and even within countries. This creates a fragmented approach to its medical use and raises questions about quality control.
Can you explain how medical cannabis works in the body?
Absolutely. The human body has what's known as an endocannabinoid system, which helps regulate functions like mood, pain, appetite, and sleep. Cannabis contains cannabinoids such as THC and CBD that interact with this system. THC, for instance, binds to receptors in the brain and nervous system, producing pain relief but also the high associated with cannabis. CBD, on the other hand, doesn't have psychoactive effects, but can reduce inflammation and anxiety. This dual action is why medical cannabis is so versatile, but also why it must be used cautiously.
What about the risks for patients?
That's an important question. The risks vary depending on the individual and how cannabis is used. For instance, smoking cannabis can harm the lungs, similar to tobacco. High doses of THC may lead to paranoia or dependency. Then there's the issue of impaired cognitive functions, particularly in younger patients or those who need to operate machinery. That's why medical cannabis should always be prescribed and monitored by a healthcare professional who can guide its safe and effective use.
How does this translate into practice? Are there standard guidelines for prescribing medical cannabis?
That's where it gets tricky. Guidelines vary widely. In some countries, it's strictly controlled and used only for specific conditions, like severe epilepsy or chronic pain that hasn't responded to other treatments. In others, it's more accessible, which can lead to misuse or overprescription. Physicians often have to weigh the potential benefits for a patient against the risks. For example, a cancer patient experiencing debilitating nausea might benefit greatly, while someone with a history of substance abuse might face higher risks. It's not a one-size-fits-all solution.
What's your outlook for the future of medical cannabis?
I believe its use will continue to grow as more research provides clearer guidance on how to maximize its benefits while minimizing risks. We're already seeing progress with standardized products that ensure consistent dosages and fewer side effects. However, education is key, not just for healthcare providers, but also for patients. There's a lot of misinformation out there, and we need to ensure that medical cannabis is seen as a therapeutic option rather than a cure-all.
That is the end of Part C. You now have 2 minutes to check your answers.